Welcome, everyone. Thank you so much for joining us today. I'm Jordan from Folia Health, and we are so excited to have our very first lupus patient panel with these three incredible lupus warriors as we close out Lupus Awareness Month for May. So thank you for all the wonderful questions that you have sent through. A lot of them were about how to manage the overwhelm and everything that comes with lupus, and not just the symptoms, but also mental health, diet, work, et cetera, and beyond. And so that's actually exactly what we are aiming to help you do with Folia. It's meant to be kind of your place to track everything that you need to related to your mental health all in one place. So you can start to connect the dots and kind of get some insights on your triggers, what's causing the flare-ups, and ultimately feel more in control of your health. So we'll send through links to download Folia. It's completely free, and we'll do that in the follow-up email as well. But for now, we want to switch gears to our incredible panelists. Each one of these ladies have had their own unique journeys with lupus, and today we'll learn more about them. We'll also have a short Q&A at the end, and I know a lot of you have sent through questions as well, and we have those, I promise. So if there's anything else that you wanted to ask, feel free to send those in the chat. And we're going to get through as many as we can today. But for now, we'll take our time to shift over. And so I see Marisa on my screen first. So would you all be able to just introduce yourself and maybe give a little overview of your lupus journey, starting with Marisa?
Sure, absolutely. Hi, I'm Marisa. A lot of people know me online as Lupus Chick. I've been diagnosed for over 20 years. I'm 47, but I've definitely had lupus symptoms very clearly since I was 8. I think as my awareness got, better and doctors started testing more, I finally was able to get diagnosed at 23. And then shortly after, I started Lupus Check. Started as a blog to just really meet other people, and it just kind of grew into this awareness platform and nonprofit. And it's just been an amazing journey.
Awesome. And I see Shanelle next, so I'll toss it to you. Oh, I think you might just be muted, Shanelle.
I think somebody helped me. There you go. Sorry about that. I'm not going to touch it ever again in this show. All right, my name is Shanelle Gabirel. I'm a poet, a singer, and I am a lupus advocate. I've had lupus since about 20 years, similar to Marissa, just about a little over 20 years. And when I was diagnosed, I was in college and just trying to figure out my life, and then started having all of these symptoms maybe around most of my sophomore year. And that were everything from headaches to aches and pains to struggling to stay awake everywhere, and just a slew of other symptoms. But then I lost my hair, and that made me go to the doctor. And so that took me on a journey to be diagnosed with lupus, systematic lupus. And I also have lupus antiphospholipid syndrome, which I don't think much people talk about often. So, and here I am 20 years later, and hoping to continue to do well.
And then last but not least, Genny.
Hi, good evening, everyone. My name is Genny Mack, and I just want to thank Folia Health for this opportunity. And I'm very grateful to be alongside Marissa and Shanelle, both incredible advocates, warriors, and change makers in this space. So it's an honor to be here. My lupus journey started about a decade ago, and it started after working a very stressful and demanding career. I was at the height of my career, working as a certified public accountant, traveling the world, working overtime. And lupus really forced me to start to take care of myself. My diagnosis journey wasn't easy. I started showing symptoms and signs in my early 20s. And once I started showing symptoms and signs of severe symptoms, chest pain, drastic weight loss, hospitalization, it forced me to start to take control of my health. So that's when I transitioned from being a public accountant to a wellness coach. So I'm a holistic nutritionist and wellness coach, and my mission is to empower individuals to reclaim their health. So that's what brings me here today.
Amazing. Thank you all. And thanks for sharing those intros with us. So kind of to that point, Jenny mentioned a little bit about your diagnostic journey being a little bit difficult. And so I guess I'll open this up to anyone, but this is something that we hear often where that those early stages, it is really difficult and it's hard to navigate. And you start noticing some symptoms, but then maybe it takes something to be like to push you to take a little bit more action or see a certain doctor. So in terms of your path, like can you shed a little bit of light? What was that like? Were you able to get referred to the correct providers? Did you have to advocate for certain care or any insights that might help other people kind of going through that diagnostic odyssey?
Yeah, I'm happy to just jump in and share. My diagnostic journey, as I mentioned, I was showing early signs of lupus in my early 20s, and it started with my primary care physician seeing signs of anemia, seeing a positive double-stranded DNA number, right? My antibody markers were elevated, my inflammatory markers were elevated. And then I was showing signs of fatigue, right? So that was the start of lupus being a possibility on top of a genetic factor being a part of this circle, right? My mom has lupus. And going to the first rheumatologist, the rheumatologist looked at me, looked at my hair. This is when I had a bigger afro, looked at my cheeks and said I didn't have a malar rash and said I didn't have lupus, right? And sent me on my way. So I've heard this happen before to individuals in the lupus community that doctors don't always listen to your full story, right? And it really requires advocacy, you standing up for yourself, you understanding what's happening in your body, or at least tracking your symptoms, right? And even bringing someone alongside you in the room to help you sort of answer those difficult questions or remind you of what symptoms you've experienced over the past couple of months, right? So lupus is a complex disease. And I'll just stop there. So that's been my experience with getting diagnosed.
Yeah, for me, I think diagnosis was it is to what Jenny just said. Yes, it's a very very complex disease, and I think the thing that happened for me was I was able to excuse away everything I was feeling because they don't seem like they relate to each other. Like, okay, my hair is falling out, my fingers turn colors in the cold. My knee hurts, my wrist hurts. It was like I ran out of excuses when the hair fell out. But that's one of the things that is really challenging, I think, about, getting diagnosed with lupus. I always say that I was very lucky that my primary care physician, literally in the right next door in the suite, was a rheumatologist. So he knew to think about lupus, and that was what helped me. And that's why it only took me a year. But also, the reason it took me a year was I went to the on campus doctor, like, hey, I'm having really bad headaches and my knee hurts. And they said I can't give blood in the blood drive. And it's like, oh, well, just you should eat more red meat. It's so easy to kind of not piece it together. So I think one of the things I didn't reveal all my symptoms when I went to the primary care doctor either. It was the second visit when he saw my positive ANA was when he started asking like, hey, are you achy? Are you and so I think it does come for us, like, having to, like, trust ourselves when we feel something that there might be something wrong and say the whole thing and not just, like, piecemeal it. That was my experience.
Yeah, I want to jump on that also because I didn't really have like a normal like diagnosis path. I mean, I don't know if there is per se a normal diagnosis path, but what I've learned since then, like whether it's lupus or some other chronic illness or whatnot, like I journaled many, many years ago before we had, trackers like Folia, like literally just a notebook and would write things down because I think for so long, like you both were saying, you don't see the correlation of certain things. So that's why I tell people like even if you think it doesn't matter, write it down in your tracker, your journal or whatever, because if you're waiting 6 months to get to that doctor, there's absolutely no way you're going to remember that 4 months ago when you were out in the sun, you got a fever and maybe a rash but it went away a few days later. But then maybe a week later, you broke out in some mouth sores, and you had really bad joint pain. So you don't start piecing all these things together. Or if it's like a one-off, like maybe you had undergo like severe stress and you broke out with like nose or scalp or mouth sores, but they never came back after that. You may not even mention something like that, but it could just be those tiny little clues. Like, that's why in the 80s, when I was trying to get diagnosed and I was 8 years old, it's like I had mouth sores, I had photosensitivity, and very specific things that are lupus, like criteria based. So I think if we're able to bring that tracking data and say, hey, this only happened one time, but it might be important, it might be a clue. We really need to consider all things, like just correlate all of them together until you determine maybe, they don't actually go together, but give your doctor as much information as possible.
That's such a good point. And we actually just got a comment that I think, or I guess comment slash maybe we can turn into a question I think is relevant because this probably happens. I know this happens a lot more than we want it to, but you go to the doctor and you show them, you say like, these are all the things that I've just experienced. And then they're like, well, there's nothing wrong with you. And so how did you navigate those situations?
Yeah.
Yeah.
I was gonna say, I mean, for me, it's I go to a different doctor. Like my primary care, not the one I got diagnosed with, God rest his soul, but another doctor. The doctor I go to is a suite, and when I was having trouble with one, I just said switch. Like a boo or a boyfriend, I just switch. If that relationship isn't working out, and I think it's hard because sometimes like doctors, they're supposed to know everything when they don't. They're humans. They read books and a lot of books and did a lot of work to become doctors, but they're also human and they don't always understand and know. And then, culturally, sometimes these things, get factored in into like who people believe and who they don't believe. A lot of times as a woman, they blame everything on your cycle. Everything is, oh, it's your hormones. No, this is a problem all month long. And so I think it's really important for you to really listen to your body. And if somebody does not want to help you, switch.
Yeah. I think second opinions are great. I mean, and sometimes, I hear a lot from especially those that live in more rural areas or depending on their insurance, they don't really have a second doctor that they can so easily go to. So then I think it comes down to, I mean, because medical gaslighting is a real thing. And so advocating for yourself, but before you even get to that appointment, in your own language, have a sentence or two that you're comfortable saying in the sense of, I understand that my labs look okay, but I know that I've never felt this way before, or I don't feel right. And I am not comfortable leaving here and waiting another 6 months until I see you again and still feeling this way 6 months from now. So what can we do before I leave here? Are there any labs we can run? Are there any other tests that we can do? Because I feel like we might be missing something. And you just have to be firm and kind, because they're a human being and we have no idea what we're walking into, what kind of day they had. But I think letting them know, like, I'm coming to you for help and I don't want to just fully look at just labs. I want to also look at how I'm feeling. So what can we do before I leave here today? Because I am not comfortable walking out that door with just that answer. And I think in most cases, a doctor will appreciate that. And hopefully go to the next step.
You're so sweet. I'm sorry. There's such a lovely balance between the two of us. Some people are like, maybe we don't need to break up. We just need to counsel. We just need to communicate better. And I think it's a beautiful thing. No,
I'm all for breaking up too, though. I just, like, I've heard from people and they're like, well, my insurance, like, there's no other, like, sometimes there's no rheumatologist around for literally hundreds of miles, right? So it's like they're forced to stick with someone sometimes that unfortunately isn't a great provider.
That actually that's another question that we got where someone's asking how was it so easy to switch? It's expensive, you're going through insurance, there are all these factors. Maybe if you have any insight on that, that could be helpful too.
any thoughts,
Yeah,
Jen?
I was just going to say that Yeah, I would agree that if you don't feel comfortable with your doctor, then definitely look to see if you can get a second opinion. It's not easy, right? It depends on your health insurance, and we know that medical care in the US is difficult, and with the administration, things get even more complicated. So, yeah, getting a second opinion. And I also just wanted to add to the points that Chanel and Marissa raised. So it's important for the doctors to understand what's going on, but I also think as individuals with chronic symptoms, right, whether it's lupus or autoimmune conditions, it's important for us to understand how to interpret our blood work. I think there should be more education around understanding blood work, because even though the doctors will say there's nothing wrong with you, if we're able to look at our blood work and say, well, my hemoglobin numbers are kind of low, my vitamin D, that hasn't been tested. Should I see if my vitamin D levels are low? Right? So I think there should be more education around understanding blood work, because if we're able to do that, then we can go into our appointments and be more, what I say, targeted on what's happening, because we only have what, 15 minutes, 30 minutes if we're really lucky with the doctor. So it's really about using that time wisely.
That's such a good point. And it seems like there's several people, a lot of people that are tuning in today that are going through similar things where maybe the doctor told you it was the flu. You've been going in and they keep saying that you just have the flu or that your blood work is normal or they won't even run blood work. It seems like that seems to be a common thread here, and kind of having to prove like why you need those labs or those exams. And I think to Marissa's point, you mentioned like maybe even the labs are showing that you're okay. And like you everything looks good on paper, quote unquote, but that's not how you feel. So something is obviously still wrong. How did you navigate that with your doctors if your labs weren't showing some clear thing signal to them like, oh, this must be going on, and have those conversations?
Funny, I was gonna say, one of the things that ways that I was able to subvert, the rheumatologist is a little more challenging, but sometimes we have these primary care doctors who just it takes so much to give you a referral. You're like, you don't even have to figure this out. Just send
Yeah.
me there.
Yeah.
And one of the ways, and like I said, once again, this is everyone's insurance is different. I've found success in going to urgent cares, because they can refer, and at least for my insurance. So sometimes that's my way around it. But a lot of times yeah, I definitely have those times where my blood work is amazing and I feel like trash. Like I feel horrible. I'm really fatigued. I'm falling asleep everywhere. My body's drained. And trying to communicate that I think, is really, really challenging. But once again, it's empowering to recognize that, you know how you feel, you know what's going on. Lupus is a one of the things that makes it complex is lupus is a self-reported disease. I have to tell you how I feel, for you to know how lupus impacts me in a lot of the case. So just being able to like really, really try to communicate and try your best to see if like I said, if a primary care is maybe not helpful, maybe you go to an urgent care, which is a lot cheaper than a ER. So go to
Yeah.
urgent care, and sometimes they can help bypass that referral process. They can be the referral for you.
I'll jump in really quick too. I think also if you have that relationship with your doctor, like I finally do have a relationship like that with my primary doctor, that because sometimes like the lupus medications we take, our blood work will look okay. That's what the medication's supposed to do. So it will be in range, right? Especially if you're on, like, I've been on steroids for 15 years. So that can mask a lot of things. But I know what like right when I'm going into a flare, I have like 4 or 5 very specific symptoms that come every single time. And so they may not show up on the blood work at that point. They may be masked by other things, but like my doctor knows if I'm walking in there and I have sores in my mouth and I have like a little bit of a rash somewhere on my body and I have a low grade fever and I'm just exhausted, and he can tell, like I look like I just rolled out of a dumpster, and he's like, this is not the normal Marissa that's coming in here. Um, he will start me, like we will adjust my medicines. He might put me on something else, like in addition to it. So I think just having, finding a provider, whether it's your primary or your rheumatologist or your nephrologist or whoever it is that you feel like most comfortable with, that knows you at your baseline and then when something's off. So isn't only looking just at what blood work says. And I totally agree with Genny on we need to do better as far as letting patients know about their blood work and how to read it, because we're now living in an age where we often get our blood work on my chart way before we see our doctor, right? And we're like, what is this? And that just sometimes evokes even more stress, right? Because now you're waiting to hear something. And we know that stress and lupus do not play nicely. So
That's such a good point. It's so true. I was speaking to someone a while ago and she was like, I will not look, I won't even open it if I go in for labs until my doctor calls me because that's the only way that she can temper the stress that comes along with it because you see all these numbers and you don't necessarily know what they mean and it's really hard to navigate that. For I guess I have like almost like a two-part question. So one is when you're feel like early days, kind of before you have your treatment plan set, you kind of have a way to manage some of the symptoms a bit more. How did you manage your health in those early days or in that like testing period of when you're trying to find that right treatment? Or slash or like if you're, Marcia, you mentioned like going into a flare, like if you're kind of feeling these things come on, or Shelly mentioned feeling super fatigued, and it's like the last thing you want to do is like get out and write down like all the symptoms that you're experiencing. So how do you, I guess like how do you navigate that then or now?
I'll jump in. I'll say then I didn't manage my symptoms well. I went through a period of denial. Okay, I had lupus, but I'm going to keep working. I'm going to keep clubbing. I'm going to keep partying and drinking. So I went through that denial stage where I didn't take lupus seriously, and it took a hospitalization. It took me going through debilitating symptoms to say, all right, I got to take lupus serious, right? And that's where I was put on different types of immunosuppressive therapy. So I think a lot of us go through that denial period, right? So that's a process in itself. But for me, how I manage lupus now is mostly through what I call holistic wellness, through lifestyle. It's more than just diet, it's really about tapping into the body to understand how I feel. What does stress actually mean for me? What are stressors? What are triggers? Um, it's more than just this word stress. It's relationships, it's inner critics, it's people pleasing, it's doubts. So I had to do a lot of soul searching during this wellness journey, which brings me here today. And how I manage lupus is mostly around managing stress and setting boundaries. And then on top of that, I do have a relationship with my rheumatologist, my nephrologist, my primary care doctor, right? My whole care team. And they know the importance of me to figure out what I can do best to manage my lupus, right? But also taking medications, right? As well, which is very important for me to reduce the inflammation. So yeah, it's a combined approach for me, but most importantly, it starts with accepting the diagnosis.
I'll say, I mean, as a cosign, I definitely didn't, I did the denial thing. I was like, okay, give me these medications and I'm going to be on my way. And of course, yes, a hospitalization, and it was my first time ever being hospitalized. And also, keep in mind, like I was in college, so I definitely was trying to, like Jenny, I was in the club, I was in these streets and hanging out and not always taking the best care of myself. I took better care of myself than many of my friends, which was like why lupus was such a shock to me because I was working out. I was, as far as I was concerned, I was taking care of myself. But now I had to do even more. And so today I try to it's starting to take a lot to get me raveled up, riled up. I really have tried to get into the space of release in a lot of ways because the stress of trying to do everything, thinking that if you don't do everything, you're not valuable. Like that's something very hard for type A personalities like me to let go of the need to be successful and the need to be strong so that everybody, it's like this brings me joy. I'm going to do this, and maybe this is hard too, but I know where my body is. And I think I've just really spent a lot of time learning my body and learning what it's telling me. Not waiting till there's a flare. Like there are signs that I'm about to have a flare. And so what do I do before that is the things that I focus on. How do I make sure that I don't have any flares? Because we know that every flare can cause more damage to the body. So it's about preventing the flare. And that's kind of how I try to manage it, just managing my stress and stretching a lot more and just taking care of my joints and my body.
I agree with that. I'm going to jump on there too. I think Jenny, said holistic, and I think that's the best way to look at it. I think for a lot of us in the beginning, we don't handle it well because we don't know yet. We don't know how lupus affects us. We don't know what our triggers are generally in the beginning. Those are all things that take time. Um, and I think, there's that grieving process. There definitely is that denial piece. I was diagnosed also in college and they gave me the usual meds at the very beginning and I refused to take them for about a year and wound up with a pulmonary embolism and like stopped me in my tracks, and then it was like, okay, this is serious. And I think you can't keep pushing your body to the brink. I don't know if any of you ever listened to Dr. Gabor Mate. He's one of my favorites, and he really digs into type A personalities and autoimmune, and there's such a correlation there, right? And okay, and maybe it is innately driven in us that is our personality, because we are go-getters, we like to succeed, we're motivated. When you have an autoimmune disease, you can still do all of that, but you really need to learn balance and what is worth being aggravated about, which is really not much in the grand scheme of things. So there is so much like intimately learning about yourself, and it's not just on the physical level. And I think that only comes with time.
We had a lot of questions about how to kind of manage mental health and lupus. And I feel like this is naturally kind of leading in that direction, which one is it's learning your body, right? You've mentioned that. It's just understanding how things affect you, understanding you're setting those boundaries, like Jenny mentioned. Do you have any, I guess, tips or advice for people, especially when they're kind of maybe in that earlier stage or they're early diagnosed or going through the diagnostic odyssey? And it feels like an impossible ask to, like, not worry about something that you don't know what's gonna happen or how it's gonna affect your body, but do you in like, they always say hindsight's 20/20. Is there anything that you wanna share?
I guess the hardest thing is just recognizing that you can only control what you can control and focus on the things that you can control. Like for me, a lot of my mental health stress a lot of my stress outside of lupus has been trying to control everything. And I feel like that release of I have it all planned out. I have everything figured out to a T. It's not realistic because we just live in a world that things happen and things change and things shift. And I think releasing this idea of who I need to be and was really, really helpful for me. The first thing I'd say to somebody newly diagnosed is please get a therapist. They do not push this. It's very much that's one of the things that I really champion. You get this life-changing, life-altering disease, and people are like, "All right, bye." You know? I think that conversation that like, what would we do if somebody had a really bad breakup, right? A divorce or somebody passed away. Like, all of these things are like life events and life-changing events, and we know what to do there. I think because we have a chronic illness that also we look good on the surface. Sometimes we think we can get by just on that's looking good, and really being honest with ourselves is just really important very early on of like, okay, I don't feel well. What do I need to do? What can I do? What do I have control of? And focusing on that and having support to talk about it with is super important.
Yeah, and I just want to add to what Marissa and Chanel beautifully said. I want to think about the diet angle as well. Just to say that our gut and our brain are connected, right? So what we eat from a dietary perspective has a direct correlation. It can have a direct correlation to our mental health. 70% of our immune system is in our gut. They say our gut is our second brain. And then also, over 90% of serotonin, which is the happy chemical, is produced in our gut. So, this is why I'm so, I so strongly talk about diet and lifestyle because it does have a direct correlation on our mental health. And yeah, just like Chanel said, go see a therapist. I think oftentimes in the BIPOC community, even, we're taught to be strong and just kind of suck it up, right? But what about our feelings? What about our emotions? It's really important to acknowledge that and to be able to share and use our voice and articulate how we feel. So I agree on everything that was said.
Yeah, I'm going to jump into with Jenny on the nutrition because there is such a correlation, right? You know, if you eat terribly for a couple of days, like I know now as someone with lupus that eats fairly, like pretty clean all the time. Like if you eat bad, like your body lets you know immediately, right? It's because it's like, hey, we don't like this stuff anymore. But I think, especially with social media and whatnot, we see a lot of different messages coming this way of what you should be eating. So I just want to throw this out there. There is typically a really high correlation with people that have lupus and autoimmune also having a lot of allergic issues and allergies. So you could be eating what you think is the absolute healthiest things in the supermarket. But if you don't go see an allergist or get a food sensitivity or food allergy profile and even know what your body doesn't like. So I will give you an example. I love avocados. I was eating like 1 to 2 a day for years. I had a couple allergy tests, and those things were so high. And they're like, okay, you don't have anaphylaxis, but you're having an allergic reaction in your stomach every time you eat it. But in my mind, I'm thinking I'm eating the healthiest food possible, right? So before you can even sort of make, I feel like your food plan, find out what your body does and doesn't like. Cause I think it's like an 80–90% correlation that people that have lupus typically have some food allergies. So I think that's really important.
Yeah, and I'll just jump in. I remember I did a presentation with Folia Health and we talked about diet. And precisely as Marissa said, I talked about how most of the time we have food allergies or intolerances, and it's important for us to know that, right? And I will also say that food allergies usually stick. Usually we're born with food allergies like shellfish or nut allergies, right? And if you have those, avoid, right? But if you have food intolerances, those can actually change when your health starts to improve, when you're able to start digesting and absorbing those foods. But that changed with the evolution of your gut microbiome. So there is definitely a correlation of allergies, food intolerances, and majority of the people with autoimmune and chronic illnesses should definitely get tested for that.
Thank you all. Those are such good reminders. Um, on the topic of testing too, we did have a question. So I want to say we can't offer any medical advice through this webinar, but the question is about any type of blood work that should be done routinely to help monitor for lupus. And so maybe not speaking directly to that, but if there's anything that you personally do that's helpful for you, like any test that you personally request for, then we can talk about it that way if you're comfortable sharing.
Well, I think vitamin D, it's something that we don't talk enough about, especially as communities that don't necessarily walk everywhere and don't get that sunlight. And then, we're also photosensitive. So all of those things kind of play a role in it. And I don't think doctors always think to look at that. So I think that that would be really, really helpful to just kind of make sure you're thinking about, and also checking your iron. We are anemia is very common for us, and then if you're a person with a uterus and your cycle starts, like these are all things that just make that so challenging. So just monitoring those two things, I want to say for me, are really, really important. And I do feel better when like more a little bit more energy when I'm able to know what's going on with those two.
And I'll just add to that, getting your B12 tested because that can correlate to your energy levels. If you're feeling chronically fatigued, right, it's probably a reason of you being low with iron, but also your energy vitamins. So testing for B12, vitamin D, looking at how you metabolize your blood sugar. So looking at your A1C is also very important. But I would say working with, as Marisa mentioned, a dietitian or a nutritionist that can help you determine what labs to get tested, because 9 times out of 10, if you're going through a lupus flare, you probably are nutritionally deficient as well. So looking at different lab work there, I would just talk about that more generally.
Yeah, and I'm just gonna jump in. I think if there's anyone here that is like being tested for lupus currently or other autoimmune diseases, the usual run is with traditional medicine, you're going to go and take, 10, 15 tubes of blood multiple times and kind of look at the responses plus your symptoms. There's a test that I love. It's definitely newer on the scene. I'd say in the last decade, and I don't have like any like tie to them personally, but I do love the test and I've had it done a few times. It's called an Avise CTD test, and it's like a 99% accuracy of 100 autoimmune diseases, and it's a tube of blood. So it's like there are better tests out there that are newer, but I think because the way things go through insurance and we're sort of in this like archaic, let's do it the old way where we take 15 tubes of blood. If you're not getting answers that way, I'd say ask your doctor to then do this test and try to get an answer that way if the old, typical way is not working.
And I would just add, I think just ask your doctor. Like, I think asking your doctor to explain to you what they're ordering and why. I think that that's also a part of the empowerment. Like you want to know, I want to be an expert and I'm a geek that way. I want to be an expert in what's going on in my body and what you're doing to my body and why you're doing it. So that even if I do have to switch doctors, I can explain a little bit. I love being able to talk through my illness, with a doctor and be able to say, okay, so usually my INR is here. Usually my white blood cell count, they're like, oh, that's low. I'm like, actually, that's pretty good for me, like, and because our bodies all operate differently. So I think just being able to ask questions and, sometimes Google can help you understand and break down some of the things that you do see when you do go into your labs. And I think that's important to be able to just know a little bit more for yourself.
If I could just jump in, Chanel, and Marissa just gave me an idea. I think it would also be very helpful for us to understand how our genetics play a role in our lupus diagnosis. So, being able to get a genetic testing, a genetic panel of some sort done is very helpful. So, I know personally that because I have this gene, it's called the APOL1 gene, that makes me more susceptible to get lupus nephritis, right? So I think it's important to understand, again, genetically, how can lupus come about? Not easy, but at least having that conversation with the doctor is important.
I agree with that. I'm going to jump on that too as well because you know, Chanel had mentioned like anemia is very common with lupus. It's definitely something I've struggled with for years. I get iron infusions all the time. Um, but you don't want to just look at like your hemoglobin and your hematocrit. Like ask your doctors for things like your ferritin, get a ferritin blood test, get a TIBC, like total iron blood count. Ask for a transferrin saturation test so you could actually see how much is getting, linked to oxygen and floating around your body, right? And usually a lot of that is done. Some primaries will run it, but sometimes they will then shift you over to an oncologist, hematologist. And they can do also some other genetic, like Jenny was mentioning. So I'm Italian and Middle Eastern, and I have a form of a thalassemia, which is also iron related, right? So it's like I have not just the lupus hitting the iron, I have this thalassemia gene from my ancestry. So it kind of like doubled down, right? Um, that's only through like a ton of research and thankfully having doctors that ran these tests. And then, like Shanelle was saying, what are these? Why are we doing them? And tell me about them.
Yeah, that's such a good point to just is to ask your doctors about them, to ask them to explain it to you. And I feel like that's something where sometimes I'm speaking for myself. You go in and then you're like, okay, yeah, just like tell me what to do. But like to be like, no, like I want to know. I should know more than anybody what's happening in my body. So it's just a good reminder for that. We did have a question about lupus and dating and just how you've navigated that, if anyone is open to sharing about that. But I feel like it's a topic that's not often talked about. And so I would love to touch on it if you're willing to share.
I love this topic because no one thinks about it. It's like we're only our disease and trying to get better. This is a part of our life too. And so I really adore having conversations about how do you start that. I mean, I think the thing that's important is to recognize you are not your illness. You don't have to lead with that at a date. You don't have to, unless it should come up naturally, but it's not like someone is, "Oh, I'm so sorry, just letting you know I have lupus. Do you still wanna date me?" Like, you're still the amazing person you were without the disease. You're still a wonderful person. So, this does not make you at a deficit. It can also sometimes weed out who's actually like really a concerned partner, who's a really caring and nurturing person, how they respond to it. But I think, really trying to date for the same reasons that people that don't have a chronic illness do. You're looking for a partner, you're looking for somebody who makes you laugh or whatever the things are that really matter to you, that's still the thing. And yeah, now just don't let the lupus become the only topic. And I've seen that happen with a friend of mine who dated somebody with lupus. He says, "I know all about your illness." First date, she gave me the whole rundown and told me all the blood work. And I was like, "Really?" He was like, "Yeah." I was like, I'm asking her like, "So what was your childhood like?" "It was terrible." And so it's just realizing that like you're still a whole person. You should have other interests, other hobbies, other things you love, and get that good and get good with that. And I think bringing somebody else in that just brings you joy is really what you should be focused on when it comes to dating with this.
I'll jump in there really quick. I think if you're looking for a partner, like a long-term partner, we hear a lot about red flags now. Chanel just points something out. Like if you are sick, or if you're talking about, if, say they ask you about it or you bring it up, however it naturally happens. I would say if someone like really doesn't seem very interested or doesn't ask you a lot of questions or makes you feel dismissed in any way or slighted, or if you're dating and you're in a flare up and you see, that like Chanel mentioned, there isn't a lot of compassion, there isn't a lot of empathy. Um, those are really important things to pay attention to. I think when you're younger, maybe you don't recognize those things or you don't look for them so much when you're really young. I know when I was in my 20s, like, listen, we didn't have social media. You never even really heard about all of these things. Um, but I think long term, that will never work out well. Like, you want someone that is in it with you. And that, to me, like, if I ever had to do it all over again, like, I want someone that is compassionate and empathetic and knows me well enough that if I am ever in a state where I cannot speak and advocate for myself, that my partner is prepared and the type of human being for me personally that they are going to be my voice so that I can get the best care possible. I think that that's really important when you're living with a chronic illness. And it's not something that we like go in looking for, right? But you can see those personality traits as you're dating someone, if you're open to looking to them and you're honest with yourself of whether or not they exist in that person.
And I'll just jump in and say that it's possible to have a life partner with lupus. I've been married for 6 years, and my husband has seen me clubbing, having a good time, us partying together, to being sick, right? 40 pounds sicker, being barely able to walk and speak up for myself, and having to get me in and out of the bathtub. So it's definitely possible to find love. I think the lessons that I've learned is to really think about what makes you happy, what brings you joy. I did notice that throughout some times in my relationship that I would talk about lupus so much, and that just became the forefront of our relationship. So I had to go back and remember what it felt like to date, making sure that I put date nights on the calendar and watching a movie together. And even if I'm not feeling good, find some joy in just our conversation or just playing some jazz together. So, yeah, it's possible.
Oh, those are all such good reminders of things, and definitely love hearing all of that. I can't believe how fast this time has gone by. So we have one last question, and then I have to let you guys go as much as I don't want to. So this is kind of like a two-part, or I guess it's like almost like a three-part question. But the question is, are you willing to share anything about your worst flare-up and how you, like the steps that you took to recover from that flare-up? And then on the second part of it is when you went back to work, how did you explain like what you went through and any accommodations that you needed for lupus?
I'll go. My situation has been a bit tricky because during my first flare, I was working in corporate America, and I was able to take short-term disability. So I was out of work for 4 months and really spent that time to recover, to literally figure out how to walk again, being able to eat again. And that was good. But I realized that when I went back into work, that was the stressful environment that was causing me sickness. So that's when I changed careers. And then when I went into entrepreneurship, I went through another flare after getting COVID. And that forced me to take care of myself even more. So I went through the system and, went through disability as well. And that has been very helpful to give me the insurance, to give me the resources for doctor care and support. And I actually try to go back to corporate America. I haven't talked much about this in 2024. And it was for this incredible opportunity, making a lot of money. But I only lasted 10 weeks because I realized that that wasn't the environment that was conducive to having a healthy lifestyle. So yeah, there's a lot there. And I would just say that it's okay to ask for time off from your employer. Lupus is a chronic disease, it's an official disability, right? So understanding that and knowing that you are protected is very important. And don't be afraid to take as much time as you need.
Yeah, I'm gonna jump in on that too. Like, I work from home, so I have a little bit of a different situation, but I've done a lot of research and speaking on the accommodations part of it. And when I went back into full-time journalism years ago and worked for a large newspaper, I once they looked in, everyone looks up your resume and they look your name up online. It's just what employers do at this point. So they were all very aware that I had lupus, obviously. And I was very upfront at that meeting of, I have treatments. I go and I'm there the whole day in getting my IV. I can work from there, but I will not be in the office. And I sort of put everything out on the table of my accommodations. And I said to them, like, I know what I bring to the table for this job. And if you're willing to work with me, then it could be a good match, right? Now, the ADA, depending on how many employees your employer has, like, you are protected under that law. But it's really up to you during your interview or whatnot if you even want to disclose your illness. But if you do want accommodations, you are going to have to disclose some personal information. Um, but accommodations are there to help you. And I always tell people, like, nothing is too outlandish. Like with lupus, if you're working under fluorescent lights for 8 hours a day, you can ask them to change the lighting, in your cubicle or in your office. That is a reasonable accommodation. And if you need to show them that paperwork that those type of lights cause rashes and fevers and flare-ups, then that's what you do. I've had people that have IBD and they request to be right near a restroom, and it's just easier for them. If you need to work remotely sometimes, if you're going to have treatment, like these are all reasonable with lupus. So I feel like sometimes people are very nervous and they feel like they're asking for too much. But if they help you get your job done, I feel like most employers, at least today, like after COVID and working remotely, I feel like we're actually in a much better situation than we were previously. And again, it all comes with, I think, confidence and time and being okay to, speak up for yourself and advocate for yourself.
Yeah, I think for me, I feel like the initial question was your worst flare, and my worst flare was I've been an artist, I've been a poet and a singer for a number of years. I've toured, and I happened to have been touring in Montana when I had the pulmonary embolisms, and then they told me, "Oh, this is another part of lupus antiphospholipid syndrome." And my everything was sore and achy, but I ignored it. And I walked around with 2 pulmonary embolisms in my lung for 2 days, which is crazy, but that was my job at the time, being a performer, and if I didn't get on stage, I couldn't pay my rent, it's things like that. And so, for me, it made me go, "Okay, I actually think I need to change my career for a second, and maybe I'll go back to it." But, and that's how I got into education, and, it's like I had to kind of sit with myself and say, what is the other thing that I love? What is the other thing what are my skills? What are my transferable skills with what I do? And it just kind of I fell right into education and worked at several schools and then worked at a nonprofit. And then about 2 years ago, I said goodbye to that nonprofit and went back to work for myself. And I'm a touring artist now. And so for me, what it's been is just sometimes we recognize that our body goes through seasons, and sometimes we got to step back, and sometimes we have to, and it's as hard as it is, because it was hard to go from being on the road to, like, my first real job, 9 to 5. I was 30. It was a very big transition for me. But yeah, once again, just really focusing on, like, okay, I can't do this, not like what now, but now what? Like, what are the things that bring me joy? What are the things that are easy hanging fruit that I can jump into for a season or longer than that? And then when I'm doing well, maybe that'll be a better time for me to go back into the thing I really want to do.
Goes back to the balancing that we talked about earlier. And just setting your own boundaries and what you need. Um, this has been so amazing. Thank you all so much for being with us today and for sharing all of this with our community. It's just been really, really helpful to hear. We know we got tons more questions that we didn't have a chance to get to, but all three of these ladies have been amazing. They create some content for us as well. So we do plan to address those in forms of different pieces of content, whether it's a video, a written piece, or whatnot. So thank you everyone for sending them in. I'm sorry we couldn't get to them all today. And we'll make sure to send a follow-up email tomorrow with the recording and just some links and whatnot. So thank you again, ladies. We really appreciate it.
Thank you.
Thank you so much. And I also just want to quickly say thank you to Marisa. Well, Shanelle as well, just for being, oh my goodness, it's been amazing just to watch your individual journeys. And Marissa, just reading your book and having this as a resource during my healing journey has been fantastic. So if anybody doesn't have Chronically Fabulous, please get it. So thank you. I
You're
just had to
sweet.
put that in there.
That was very sweet, Jenny. Thank you. Thank you.
She
I
also has a
love
TED Talk that went out today.
TED Talk
Yes.
was live today, and that's for any chronic illness. I made sure, even though I got lupus in there, it was for anyone with disability or chronic illness, because I want them to know, like, you still have so much life ahead of you. And I feel like in the beginning, you feel like it's all over, and that is not true.
So true. Such a good place to end. Thank you all so much.